Good evening, everyone. Today we are going to talk about an interesting topic on leucorrhea, which is a very common problem nowadays. Leucorrhea जो है ये women's mostly in adolescent to adulthood तक mostly commonly condition देखी जाती है women में. It is basically a discharge which can vary in color, character and consistency. That means that it can be either whitish, yellow, green or transparent or even translucent discharge from the vagina, and it occurs usually due to various causes, but the main cause that usually is seen is the infection inside the vagina or the uterus. Now leucorrhea is a very common problem and it can lead to even weakness later on in the advanced cases. What are the most common causes that causes leucorrhea? Now leucorrhea में जो first and foremost cause जो देखा जाता है वो है हार्मोनल डिस्टर्बेंस. आइदर पर्सन अगर किसी को इरेगुलर मेंसेस का प्रॉब्लम है, अगर किसी को कोई इन्फेक्शन है विजाइना की या कोई हार्मोनल डिस्टर्बेंस है बॉडी में, उसके कारण उनको ये कंडीशन डेवलप हो जाता है. कुछ केसेस में अनहाइजेनिक कंडीशन ऑफ द जेनिटेलिया is also responsible for this condition. Then patients who have indigestion or gastrointestinal problems such as constipation, indigestion, bloating, those persons also are seen to have this problem. इवन इन पेशेंट जिनमें इंटेस्टाइनल वर्म्स का प्रॉब्लम्स देखा जाता है, उन केसेस के अंदर भी ये कंडीशन काफ़ी कॉमन देखा गया है. अगर कोई इंजरी हुई है इंटरनल ऑर्गन्स में या वुंड्स हैं जिनमें इचिंग प्रेजेंट है और स्पेशली ऑफ द वेजाइनल कैनाल, इन दोज केसेस दिस कैन अकर. And the last and the most that causes seen is in anemia and diabetic patients also. Because of high sugar and insulin resistance, the patient is not able to digest the sugars and it increases in the blood, and that causes yeast infections, and that in turn leads to leucorrhea. Now, what are the symptoms and signs that are seen in this case? The first and foremost symptom that the women usually presents is the discharge of a whitish, thick, thin, yellowish discharge with vaginal itching. The patient has also sometimes a frothy discharge with a very strong foul smell, which can be similar to that of a foul fish or sometimes some other kind of strong cheese-like smell. Sometimes patients को soreness और rashes हो जाते हैं around the genitalial organs में. अगर इन्फेक्शन ज़्यादा है तो पेशेंट्स को frequent urging for urination रहता है with burning sensation during urination, और कुछ केसेस में इसके साथ lower abdominal pain भी रहता है और tiredness रहती है due to the loss of the fluids from the body. नाउ ये केस इन कंडीशंस के अंदर जो लeucorrhea देखा जाता है, इसमें पेशेंट को कई बार बैक एक भी साथ में डेवलप हो जाता है. अगर पेल्विक रीजन के ऑर्गन्स गेट इन्वॉल्व, देन दैट आल्सो लीड्स टू दिस पेन इन द बोथ द बैक एंड द लोअर एब्डोमेन. नाउ व्हाट आर द मैनेजमेंट एंड द होम्योपैथिक मैनेजमेंट फॉर दिस कंडीशन? जनरल मैनेजमेंट अगर देखें तो उसके अंदर बेसिकली द पेशेंट शुड हैव गुड हाइजीन ऑफ द genitalial organs. Secondly, they should have a more healthy diet in their regime. That means more intake of fresh fruits and fresh vegetables or salads, so as to make the body more alkaline, because in case of this the body becomes more acidic. Also, more intake of water is advisable because that helps to flush out the toxins from the body. And in case the patient has anemia due to this or there is some diabetic condition, then those factors also need to be checked and treated to curb this problem. Now let's discuss about the homeopathic treatment for leucorrhea. Now, homeopathic treatment of Leucorrhoea depends basically upon various factors, that is, depending upon the character of the discharge, what age the woman is in, that means whether the person is a child, is in adolescent age, is a young adult, or is a person in menopausal age, or sometimes it is also diagnosed or characterized by the discharge character, that means whether it is transparent, what color the discharge is, and what other symptoms the patient has along with that. To discuss a few medicines depending on this, also we have to take into consideration when this leucorrhea gets worse. देखा जाता है कुछ केसेस में कि अगर पेशेंट ज़्यादा एक्सर्शन करते हैं या ज़्यादा फिज़िकल वर्क इन्वॉल्व रहता है, उन केसेस में अगर लुकोरिया बढ़ जाए तो इन दोज केसेस कर्केरिया का इज़ अ गुड मेडिसिन. अगर इन्फेक्शन के कारण लुकोरिया हो रहा है पेशेंट में, यानी कि उनको फाउल स्मेलिंग डिस्चार्ज है, साथ में उसका करेक्टर येलोइश और ग्रीनिश डिस्चार्ज के साथ है और बहुत ज़्यादा स्मेली है, देन इन दोज केसेस मेडिसिन्स लाइक पायरोजन, कार्बोलिक एसिड, क्रियोजोट, अगर उनके कारण पेशेंट को एरप्शंस होने लग जाए प्राइवेट पार्ट्स में अलॉन्ग विद द लुकोरिया या बर्निंग सेंसेशन हो रहा है, then in those cases medicines such as creosote, petroleum, cantharis can be given. Then there are also other medicines that can be prescribed depending upon whether the discharge is either thin, thick, is it watery, or is it of very strong smell. So all those factors are taken into account before prescribing the medicine. Also, in cases of children, sometimes the leucorrhea is seen in very young girls also, or in the at the time of puberty when they have their first menarche, that means the first time they have their periods. In those cases, if the leucorrhea appears, in that cases, special medicines like pulsatilla or sepia or any other medicine depending upon their other physical and mental symptoms are taken into account and given. Also there is some other medicines that can be prescribed, if the leucorrhea occurs before the menses, either it occurs during the menses or it occurs in between two regular periods, or if the patient is having the leucorrhea after the menses, or along with that if it is in the menopausal age, that means after their periods have stopped, then medicines vary according to that and then these are prescribed accordingly. So this was a general information and a short video on leucorrhea, its symptoms, causes and its homeopathic management. It is advisable that if this condition is worse, that means the patient has infection, if they are having any severe pain in the lower abdomen, if they are having any burning sensations during the urination, or they are having some issues like after even in during pregnancy, some women have this problem, or after pregnancy during the postpartum period some women may develop this leucorrhea, then you have to see if it's due to the some infection or is it due to some other reason, and then the medicine is to be given accordingly. It is very important that proper hygiene is maintained. अगर पेशेंट को सम होम रेमेडीज सजेस्ट कर सकते हैं तो those are like, for example, they should increase intake of either coriander leaf water, or they can take some methi seed water in the morning, early morning. Then they can also increase the intake of bananas in their diet because they are a high source of magnesium and potassium, as well as they are very good in fiber content. So those who have constipation or some indigestion, for them it is useful, and also it helps in treating the leucorrhea. Some patients we also advise if you can soak some alum or fitgadi in a bowl of water and then let it get soaked in a cup of water for overnight, and then use that water for wash after going to the washroom. or after urination. And then there are some other home remedies that can also be used as an adjunctant therapy or supportive therapy, because diet is very important. So high intake of vitamin C rich foods, vitamin A rich foods, and those that are rich in minerals and vitamin fibers, those should be increased in the diet naturally. Also, gut health is important in this regard, because if the patient has constipation, bloating and indigestion, then in those cases also the patient gut health is affected, and so they need to increase the good pre and probiotic microorganisms in their body, and this they can do by increasing the intake of fibers. They can increase the intake of curd in their diet. Buttermilk is good for that. Then they can also increase intake of any prebiotic fermented foods that are rich in vitamin B12, such as upma, dosas and idlis. Those are really good ones if they are fermented overnight. So all these factors and an overall holistic approach along with the medicine can go a long way in treating this condition. So I hope you got some good information about this condition, and in case you got this information, please like and share and subscribe to my channel, and have a great day. Thank you.